Scenario: an elderly man who has backache. Introduce yourself and take permission. Hello, I am Dr. Muhammad, one of the surgical doctors. May I confirm your name and age, please? My name is Jack. I am 75 years old. Nice to meet you, Mr. Jack. Today, I will be your doctor. Is that okay? Go ahead, doctor. Mr. Jack, how can I help you today? I have this back pain, doc. Analyze the main complaint using Socrates. Site, onset, course, duration, character, radiation, timing, severity, aggravating and relieving factors, and associated factors. I am really sorry to hear that. Could you please tell me more about this? It started 1 month ago and getting worse recently. Where exactly do you feel that pain? In the lower part of my back. Mr. Jack, could you please point to the site? Here, doctor, in the lower part. Did it start suddenly or gradually? Gradually. Could you please describe that pain for me? Is it colicky, dull, crushing, cramping, or stabbing? It's a dull pain, doc. Mr. Jack, does it move anywhere else? No. Does it present all the time or come and go? It comes and goes. Does anything make it worse or better? I feel pain when I walk. In scale of 1 to 10, 1 being the lowest and 10 being the highest, how could you score this pain? I would say around 7. Differential diagnosis 1. Mechanical back pain. Mr. Jack, have you had a recent trauma to your back? No. History of heavy lifting? Yes. I work at a warehouse, 2 cauda equina, cord compression. Mr. Jack, do you have weakness at your leg? No. Do you have numbness at your legs or numbness at your genitals and back passage? No. Do you have any problems with your waterworks or bowel? No, doc. Mr. Jack. Have you had any difficulty in gaining an erection? Am too old for this, doctor, but it's okay. 3 malignancy. Did you experience any weight loss or loss of appetite? No. 4 POTS disease. Mr. Jack, do you have a cough? No. Do you have a fever? No. Any night sweats? No. 5 ankylosing spondylitis. Mr. Jack, do you experience any stiffness in your back at the morning? No. 6. Osteoporosis. Did you have any bone fractures that occur more easily than expected? No. Past medical and surgical history. Did you experience similar symptoms in your past? No. Mr. Jack, do you have any other medical problems? No. Do you have any history of surgical operations? No. Family history. Is there anyone else in the family had a similar problem? No. Drug history. Mr. Jack, do you take any regular medications? No. Do you have any allergy against any drug? No. Social history. I would like to ask you personal questions. Is that okay with you? Okay, go ahead. Mr. Jack, what do you do for living? I work at the warehouse, as I told you, doc. Do you have any difficulties using stairs? Yes. Do you smoke? No. Mr. Jack, do you drink alcohol? No. Ideas, concerns, and expectations. Before I go any further, could I ask, what do you think the cause is? I don't know. What are you the most concerned about? This pain. Mr. Jack, what do you hope from us to do for you? Figure it out and help me. Don't worry, we will take care of you. Systems review. Start from head to toe to make it easy. Do you have headache? No. Any SOB or cough? No. Any chest pain? No. Mr. Jack, do your heart beats? No. Do you have any problem in water work? Any problem in bowel work? No. Any muscle or joint pain? No. Anything else you want to add? No. Thank you very much, Ms. Anna. Discussion. I took clinical history from Mr. Jack, 75 years old, presented with lower back pain, started 1 month ago gradually and getting worse recently. The pain is dull in nature and increases with movement. He works as weightlifter, and his work requires heavy lifting. No symptoms suggestive of cauda equina syndrome or malignancy. My main diagnosis is mechanical back pain. What is your differential diagnosis? Cauda equina syndrome, malignancy POTS, disease of spine, osteoporosis, ankylosing spondylitis. What is your management? I will do full clinical examination including back examination, anal examination. for sensation and tone. Lower limb neurological examination, decreased power and reflexes. Then I will request blood investigations, FBC, CRP, and ESR LFTs, UNEs. Imaging, lumbosacral X-ray, urgent MRI scan, if cord compression or cauda equina is suspected. DEXA scan, if a crush fracture is suspected. Chest X-ray, and quantiferon TB gold, QFT, if TB suspected. What is your treatment? I will discuss the patient in the MDT meeting. Simple back pain, analgesia, refer to a social worker, most important. Regular exercise. Physiotherapy considers short-course muscle relaxants, cord compression, and cauda equina syndrome. Dexamethasone, urgent surgery, decompression, bilemonectomy, disectomy, malignancy, radiotherapy.